The following is intended only for mature audiences.
Open your ears and lube up your butthole. It's time for the What Do We Call It podcast. Now, here's your host. It's Jmann. Welcome to the What Do We Call It podcast. I'm Jmann.
This is Steiny.
All right, so I've been waiting for you to come over so we can talk about this fucking Luigi Mangione assassinating United Healthcare CEO Brian Thompson. Everybody knows the story, but anyways, this guy is a fucking rich asshole who's a CEO of United Healthcare, who is infamous for denying claims to the point where it is stated that this guy put AI in charge of analyzing claims at one point, and it denied 1 out of every 3 claims. You're looking at me funny. Why?
I have other information.
You go with yours then.
Okay. It was a thing where United Healthcare says that they do not deny as many claims as been stated, that they actually approve 90% of all claims that come through right away, and that the other 10% of those other 10%, 1 to 2% have to be denied due to further review. Like they just need more information, not denying it outright, just saying it gets bounced back for more information. Now, whether or not that's true or not, they have statistics on their side, but at the same point in time, what you have right now is a lot of stories that people claim a lot of things, but their data doesn't actually back it up. So the fact that the AI denied 1 out of every 3 claims, I'm not sure about that being actual true or not.
Yeah, and that's fine, because what you say, what they claim, the company themselves, sounds way too fucking rosy. And what I just told you is what I heard and read a few places sounds too damning.
Right.
Like almost too bad to be true.
Right. It goes on both ends of the spectrum.
But we both know that insurance companies are businesses,
which they shouldn't be, but yes,
are looking for profit and to cut whatever they can to maintain it or build it, and they make ungodly amounts of money. So this ritzy fucking white-collar Luigi Mangione kid had some back issue. So ankylosing spondylitis.
Yes.
A chronic inflammatory disease that affects the spine and pelvis. So Luigi Mangione, good-looking kid, has money. He's a fucking wop dago. Good fellow-looking motherfucker with a mop-top haircut, and he's a little bit chiseled. Anyways, he's kind of a pretty boy. He's got a back issue, and for whatever reason, decided, I'm going to fucking murder Brian Thompson because he's the head of the company that's denying my claims.
There's another thing for you, is they also say that him and his mom were not actual members of United Health Group.
What?
Right? I know.
Isn't that a fucking weird wrinkle, how differing the information could be? But what we can, without a shadow of a doubt, claim here is the truth. Luigi acted alone. He shot the guy multiple times. Mm-hmm. He apparently etched some fucking words into the bullet casings. Deny, depose, delay?
Delay, yep.
Okay. And the point is as much as everybody's focusing on the denials of claims and how evil healthcare companies are, Brian Thompson was already under investigation from the Department of Justice for insider trading.
Yep.
So that right there tells me that I'm sure that most people don't care he's dead.
That has been the surprising reaction. I mean, I get it on one level, but you got to understand, too, at one level do we go that this vigilante justice is okay, right? Like, it was okay to gun somebody down because you didn't get what you wanted. Now, I agree. There is a sense of futility that you cannot fight the big insurance company because what can you do, right?
Nothing.
Nothing.
They have all the power and the ability to fucking veto whatever you need.
But does that give you make it okay to use murder as the solution? That's what's disturbing to me, is the number of people that went, good, this guy deserved it. I don't know if anybody deserves that. You know what I mean?
Well, here's how I feel. Now there's people that are like, how dare you all? He's got a wife and kids. I'm guessing his wife and kids are well-kept, ritzy dicks that don't appreciate what they have.
Now you're making assumptions.
Yeah, that's fine. They're fucking rich motherfuckers. Okay. He was a rich motherfucker.
Yeah.
Rich motherfuckers in charge of companies that make tons of money, that are crushing the American populace with their high fucking fees and their shitty ass payouts. The point here is, why I'm fine with it? He's one guy in charge of a company that denied how many people their claims, their treatment, how many people have suffered or died because of decisions that came from the top and the people below him and the people below them.
That's a good question.
This is all indicative of this big fucking
Do you have any
machine.
data? Do we have any data then other than feelings, right? That's what I've been hearing about a bunch of this, though. I've been hearing a bunch of feelings. Like, I get it. We all feel like there's a problem right here, but where is this actual proof, right? Where are some statistics on this? I need to see some better numbers because obviously, as we both started out here, we're hearing numbers on both ends of the spectrum.
Yeah.
So where's the truth lie there? You know, insurance has always been a scam, whether it's auto insurance, home insurance, health insurance, you name it. It's always been a scam because you never get out as much as you put in. And you're there to basically support those who need it, who are unlucky enough to need it, right? But nobody, in my opinion, should be making money off of this. This shouldn't be a for-profit industry. And it's part of what's wrong with our broken healthcare system, right? It's part of the reason why healthcare is so expensive, right? Because we have insurance that to pay for these expensive procedures has to be so expensive because there are some people that just bleed the system dry.
Fat people, smokers, people with chronic conditions.
Baby boomers have unfortunately put a severe strain on it, and it was supposed to be, Obamacare was supposed to be, a bunch of younger people get on it to help support the older people. It was forcing people to get on it to support the older people because there wasn't enough people at a young age electively doing it. Me, in my 20s, I never had insurance, even though it was offered by our employer, our mutual employer. Mm-hmm. I didn't have it for the longest time because I wasn't getting sick. I wasn't having problems. So many young people don't feel they need it. So insurance only works when there's a collective paying into it. But when you have some people drawing so much, and when you have some things that are being paid for that shouldn't be, and other things that aren't paid for that should be, it does create a lot of tension and a lot of hostility. And I don't blame anybody for it because I get frustrated in the shit that's covered and the shit that isn't covered, right? The fact that my son's, whatchamacallit, on the end of his dick, what do they call that? Circumcision was not covered. It was absolutely crazy.
It's cosmetic.
Yeah, right. I'm sure, right? I wouldn't want to have to clean under that and deal with all that nastiness on a regular basis. Fuck that. So you know what I mean? But other stuff like dick hardening pills are covered. Seriously? Right. For people who are probably too old to be procreating, and we're going to give them dick hardening pills. Yeah. That's going to be covered. Not only that, we're going to supply it for our military, and it's going to be a huge cost for our military to cover for the goddamn people in service. That's how ridiculous our system is, right? Like, we're covering things like that, but we're not covering life-saving procedures for people like this. You know what I mean? For somebody for a severe back condition, honestly, as somebody who's had some back pains and knows what that's like, that had to be super hard and frustrating at a young age. And I'm not justifying anything what this man did.
No, I get you.
But I get his frustration was probably through the roof because he's got the rest of his life to deal with this, and they are now denying him a chance to get better, right? A chance to improve his condition, a chance to avoid some of the pain and discomfort he's going to have for the rest of his life.
Concepts like covered and not covered, and more importantly, in-network and out of network.
Oh, yeah.
Why is there anything that's out of network? It should be, if you have insurance, you can walk into any facility in the United States or a territory in which your insurance is accepted or operates, and you're fine. When I had my fucking hernia repaired in 2014, I flew to Florida. Mm-hmm. And I had a special procedure done that was technically at the time considered experimental, but it was FDA approved.
Okay. Was this in-network or out-network?
It was, believe it or not, covered by Blue Cross Blue Shield because they operate in every state.
They do. Yeah.
So even though I had BCBS of Minnesota, and some people have issues with BCBS being in other fucking states where they're based, and it's a bitch to find a doctor, it was covered. All I paid was a $20 copay for my post-op visit. That was it.
Very nice.
And now you look at Anthem. Those cocksuckers, if you know what I'm talking about, have now set it up where they're going to decide just how long a procedure should take. So not only is it bad enough that at every clinic, with every doctor, or every hospital, you might pay a different amount for the same procedure or examination. There's no across-the-board pricing, standardization of industry. And now Anthem is saying, this is how long these procedures should take. we will pay for anesthesia for that amount of time. Anything over the amount of time that we decide is reasonable for a procedure, you will pay out of pocket. And I'm like, are you fucking encouraging doctors to go faster when they shouldn't in surgery? Because we're trying to save lives and improve people's standard of living, and you're worried about a few measly bucks. And it's just like, again, Luigi didn't need to shoot this guy, but now look at the conversation that he's forcing us all to examine. And Trump has said he wants to eliminate the middleman.
What does that even mean?
He's like, you have your insurance company that tells you to file a claim so they can deny your claim instead of your doctor just directly billing your insurance like it used to be. And I want it to go back to that way. And he's got a point. Do you remember having insurance where you go to the doctor and they're like, we'll just bill your insurance? And they do it. And you never have to fucking worry about anything until you get what the leftover bill is, instead of, well, you came here, it might not be covered, you file a claim, then wait 6 weeks, we'll tell you to go fuck yourself, you'll be frustrated. iMed did it to me over a fucking ophthalmology exam, $348, and then when I finally fucking filed my claim, they said, nope, sorry, not timely enough. Fuck you, I still spent the money. So the whole thing about, you can examine his case, we don't need to examine the case. A kid took it upon himself to exact vigilante justice. He took a human life that some people are okay with, that purists are like, no, murder is never okay. You're on one side, clearly. I'm on the side that's like, these companies are letting people suffer and die, and they're all about funding treatments, not cures.
To me, then, what's to say we can't go after any CEO of any company? Because there are companies that are big and they pollute. Look at 3M. Look at Honeywell. Look at all the ones around us, right? The Cargills, the Monsantos of the world. What about Tesla? What about Elon Musk? Who's to say you can't go and gun him down because of the batteries that he uses in his car are using rare earth metals? And you know what's happening in countries that these rare earth metals are being discovered in. They're
fracking
being raped,
all
for
kinds of just water runoff and poisoning of
There's these nickel nodules at the bottom of the Pacific Ocean between Hawaii and the U.S., and they take millions of years to form, and they
those little balls, right?
Yeah, yep, and they contain them, and they want to go down there and just start mining them up off the ocean floor without any regard to what that might actually do to everything.
The oceanic ecosystem and the earth at large.
Right. So why not go after Elon? You know what I mean? He's helped propping up this industry that's, doing this. I mean, to me, it doesn't stop. When you find the justification and you say, I'm okay with it because of their decisions ruined lives, you could say that for so many corporations, so many in so many countries around the world, that you basically say it's okay for this. It can't be allowed. I agree. I don't know how to start the conversation in another way. I don't. But what you described at one point was a single-tier system where you could go to any hospital. This in-network, out-network bullshit. You're right. It all started when these hospital groups got so big that they could start funding their own HMOs, their own insurance groups. That's where our United Health Group started, right? A lot of these were, hospital networks that needed to provide care and coverage.
And they started losing money, and then private fucking equity firms started buying them up and turning them into for-profit institutions.
Exactly.
And so then you go in and they make you get all these tests you don't need.
Yep.
And then try to rush you out the door before you find out what's actually going on.
When I worked at a pediatric clinic, right, where you're supposed to be there bringing kids in for their first checkups, right? They're 3 months, they're 6 months. You're checking their weights. You know what I mean? You want to make the families feel good, right? Or at least not feel like they're being rushed in and out like they're a number. It still was, you needed to do 10 of these appointments a day. You had to get them in and out. If you were taking more than 9 or 10 minutes, that was too long. It was all about for profit. It doesn't matter where it is in the healthcare industry now.
The ER at the majority of the hospitals you go to now, the ER staff are not employees of Allina or any other medical group. Right. They are a private subcontracted company that has an installation in a hospital, and they play by their own fucking rules.
Yep.
And all that rush them in and rush them out shit you're talking about, they do that there now. Everything about this is less about human health and more about a machine that cranks out people like an assembly line to generate money. And it's a business, but this is healthcare. It shouldn't be like a fucking conglomerate or a corporation. And it's just money across the board. It was for years, you would get Big Pharma would throw kickbacks at doctors to push new drugs, to build interest, and they'd get money. And now you've got private equity firms that own hospitals, and they're trying to exhaust these fucking staff to get so many people in and out the door. And then the staff are complaining, we're tired, we're understaffed, we don't have enough equipment, we don't have enough supplies. And you want us to keep living up to your standards of performance like it's a fucking job in a factory on a press. And you have to make X amount of units an hour.
Yeah.
You want us to crank through patients like nobody's business, and we don't have the means. You used to have a baby out of your pussy and they'd send you home 3 days later. Now you go home like the next night or the morning after.
Yeah.
You have a C-section, you're only there for 3 days total. That's a major fucking surgery. They're slicing you open, pulling out a baby and fucking around your organs and stuff.
Oh, yeah.
And with
Putting them all back
Anthem,
in.
here's the funny thing. For the last 3 years, I've had United Healthcare
Okay.
for insurance. I now have Anthem. And I found out it was going to be Anthem the day before I found out this new fucking anesthesiology policy.
Sure.
And it's like, how the fuck can you do this shit? Again, I should be able to go to any doctor, any clinic in the U.S., whether I'm on vacation in another state or I'm working there, or who fucking knows? I moved there 2 weeks ago, but I still have insurance and I'm with the same company in a new job in a new city because they're a nationwide corporation. I should be able to walk in and get the treatment I need, not be looked at like dollar signs. If I come in and I say my leg hurts, we'll focus on my leg. You can do some blood work, and if everything seems fine from the blood work, maybe let's not start looking at do I have circulatory issues or any other number of bullshit things that you will go in there and they will charge you for because they're trying to get the fucking insurance money. And then the insurance companies that take the shit out of my check every other week, and then, like you said, we never get out what we put in. It's a fucking scam. All it is making me think of that scene in Tommy Boy where he's like, well, he's got the warranty, the guarantees right here in the box. Why would he put it on the box if he didn't mean it? He's like, because he knows you're going to read it. It's going to make you feel warm and fuzzy, but he knows deep down that because you think that's going to work, all he's done is sell you a guaranteed piece of shit.
Yep.
I'm butchering the quote, but I'm getting the idea, the bullet points. And that's what insurance is doing now, is supposed to make you feel warm and fuzzy.
Yep.
In the 80s, I don't ever remember my parents complaining about fucking doctor bills when I'd go or to the dentist or any of that shit. In the 90s, the same fucking thing. When I needed orthodontics, it cost this much. Fine, that's elective. Medicine, you go to the pharmacy. I don't ever remember my parents having to fucking hunt for coupons to fucking get medication like they do now. How fucking sick is that? The Big Pharma has our parents coupon clipping to try to get a deal on medication that in Mexico, fucking Mexico, costs 1/3. And they continue to just, we've got a shelf life on this cycle for this med. It's brand new, and we're going to charge an asinine amount of money for it right out of the fucking gate so we can make up for the R&D. And then you get dickbags like now incarcerated Martin Shkreli, who jacked up the price of a fucking HIV med or whatever, 5,000 fucking %. He's like, well, we deserve the money. I mean, you got HIV. It's expensive to treat. Fuck you. If you can give 23 cents worth a day to keep people in Africa on 3 pills that keep them from developing full-blown AIDS in fucking Africa, you can't tell me that in America that we can't get the same fucking luxuries here. Why the fuck are all these meds more expensive here? It's all for profit. And the answer here, I think, and people are going to hate the idea, but it's what needs to happen, is the government needs to fucking take over. Healthcare. What's the stat we keep seeing lately? 32 out of 33 developed nations have figured out how to do universal healthcare.
Well, yeah, first world nations. Yeah.
It's not magical. It's not perfect, but 32 of 33, we're the only fucking one that has it. You have seen it repeatedly since Brian Thompson was murdered.
So here's 2 things I want to get to. One, I have a little bit of an insight on the whole anesthesiology thing. As somebody who's had to have it done to him a couple times, based on my various surgeries for broken bones. One, it's expensive. So if it goes over longer, insurance companies don't want to pay for it. So if they don't cover it or whatever, Anthem, they can now charge it back to you. That becomes a cost that they can now put on the people, and therefore it doesn't have to be covered.
It's infuriating.
And, what was the other thing you said about 32 single taxpayer?
32 out of 33 developed nations have figured out universal health care.
So the hindrance right here comes down to the core problem we have as Americans, where everything should be capitalistic in nature, right? We have so many things that we feel like everybody should be able to make money. Like, why should you take that away from them? They should be able to make money doing that. Like, they need to be able to earn a living, right? Like, people who run insurance companies, obviously, if it's a huge insurance company, you don't want somebody who's just making 50 grand a year running that, right?
Yeah.
There's not enough incentive. But there has to be something that balances this, right? You cannot be having a for-profit insurance company that is paying out millions of dollars to its executives, but then denying claims that are only hundreds or thousands of dollars to people who really need them. That is so effed up and so backwards.
Now, I understand a business model that they need to generate enough revenue to have people in positions to handle the plans, handle the claims,
Right.
communicate with the doctors, communicate with the other insurance companies. That needs to happen, and obviously you need to pay a certain livable wage to make those jobs desirable. I get why there's operating costs and overhead, but as you just stated, when CEOs are making 10, 25, 30 million fucking dollars a year, and all you are is the biggest decider in charge of other deciders who then have a team of underlings who are just deciders.
Yeah.
Your CEO is a puppeteer, and he fucking pulls those marionette strings on his lower tier, his regional people, and then they're fucking underlings of the claims adjusters and all that, and it's just like sickening that one person could have all that fucking power.
Yeah. And another problem with all of this too is America right now has been on a trend for a long time of wanting less government, less regulation, which I think is dumb. I think many ways we need more regulations in certain areas. But I don't think you're going to get a big segment of the population to come around to realizing, oh, we need more government because we need government healthcare. I think there's a lot of people that are instantly going to foo it, think it's going to be terrible, like almost everything else government, right? Like, and they don't have a very good track record when it comes to programs like the VA, which is government-funded healthcare, right? You know what I mean? So I agree. This can't continue on the way it's going, but at the same point in time, I don't see it being fixed by any administration anytime soon.
Well, I just like to hammer on a few of these countries that have it. Obviously,
Botswana.
There are countries in Africa, Algeria, Botswana, Burkina Faso,
Mauritius,
Rwanda. So I don't know what Seychelles is. Tunisia. In Asia, there's Azerbaijan, Bhutan, China, Cyprus, Hong Kong, India, Indonesia, Israel, Japan, Kuwait, Macau, Malaysia, the Maldives, Pakistan, fucking Pakistan, the Philippines, Saudi Arabia, well, they have oil money, Singapore, South Korea, North Korea,
even they do.
North Korea.
Of course they do, but they're communist.
Sri Lanka, Taiwan, Thailand, Turkey, the UAE. In Europe,
pretty much everybody.
Armenia, Austria, Belgium, Croatia, the Czech Republic, Denmark, Estonia, Finland,
Everybody.
France, Georgia, Germany, Greece, Iceland, Ireland, Italy, Latvia, Lithuania, Luxembourg, the Netherlands, Norway, North Macedonia,
which is North Greece,
Poland, Portugal, Romania, Russia, Russia.
I'm telling you, every country in Europe,
Serbia,
the entire
Spain,
EU.
Sweden, Switzerland, the UK, England has it, Northern Ireland, Scotland, Wales, other crown dependencies, the Isle of Man. Then we get to North America, the Bahamas, Canada, Costa Rica, Cuba, fuck you, Mexico, come on, Trinidad and Tobago, really? And then even in South America, Argentina, Brazil, Chile, Colombia, Suriname. Oh, and then we have Oceania countries, Australia and New Zealand. That's all of them. I just named a fucking who's who on a world map of where Carmen Sandiego might be hiding, and they have figured this shit out. And here's a plan. It's going to sound stupid and hastily thought out, but here's my plan.
All right.
Here's how we do this. Government takeover. Right? No, just hear me out.
Okay.
Because now it's capitalistic and it's for profit. That is the opposite of what the Hippocratic Oath is for. It is to do no harm. Yeah. But when you are funding treatments instead of cures, the government should be fining these fucking companies tons of money if they don't process X amount of claims. There should be a department where you can submit your claim that they denied your claim and they go, okay, fuck these motherfuckers. We're going to fine them. And then the incentive becomes to start paying out more. You're not going to make billions of dollars, but suck my dick. That's not what this is about. And in terms of it being taken over, you push for cures instead of treatments. I don't give a shit if the big pharma wants to keep cranking out the big new fancy drugs for depression and anxiety every fucking
skin
8
conditions.
to 12 years. Or how many fucking new things are there for plaque psoriasis and shit?
God,
that's like
that's
the new
it.
hot topic. And they're all going to basically kill your fucking kidneys anyway.
Yeah.
So fix the conditions instead of treating them. And now, just like Johnny Law comes and steals your fucking homestead via eminent domain, the government says, guess what? You want to operate? We fucking own you now. You can either join us or die. And it's like, well, what the fuck are we supposed to do? Well, the government is acting in the interest of the American people to protect us. So we have lives to live, to exercise our liberties and experience a sense of pursuit of happiness. That pursuit of happiness is good health, so that you can be there for your loved ones. And then you can, if you're still healthy, be a productive member of society even longer. That's what we want, right? Is people cranking out more money, paying into fucking Social Security. I mean,
keeping the economy rolling by just buying shit.
You need to have the government step in now. And it sounds like fucking tyranny or communism. I don't know. But maybe, just maybe, with this one facet, they're not taking over the auto care industry. No more Wall Street bailouts. All that money that we fucking send to other nations that are at war, that are our allies, where we never get anything in fucking return other than like the sense of accomplishment of a moral victory. Skeet, 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 shoot. Fuck that. No. So if the government takes it over and they take the time to run it decently, all you have to do is examine 32 other examples of what works and what doesn't. And I bet you there's going to be a lot of collective overlap in these multiple Venn diagrams of what they're doing. And then just fucking ape what they're doing. Mimic the shit and give us what we need, so we'll have cures instead of treatments. We'll have affordable and available health care. You'll be able to go into any fucking hospital or clinic that is government owned, in which case I can't see anybody wanting to go to a privately owned for-profit clinic at that point. So then everyone can be healthier, right? And if you're a smoker or a big fat fuck because you eat too much, tough shit. Hey, you can fucking get treatments, quit smoking, and get on a better diet. But the fact that the unhealthy people are straining the system, but I think they're honestly being scapegoated.
True.
They're trying to point the fucking blame at these people, so you and I, who are healthier, go, fuck you, you're making my co-pays and fucking
you
monthly
look
shit.
Across the aisle instead of back,
Yeah, so if the government's running it now and it's being run decently, I mean, it wouldn't be by our current setup of Republican and Democrat back and forth tug of war, but I'm saying, idealistically, a middle-of-the-road type of government that cares about people and puts people first could pull this shit off. And it's like, there's a reason we have the EPA. There's a reason we have the Department of Education. There's a reason we have the Department of Justice. These are all arms of the government that are here to regulate industries or segments of people, like law enforcement. Mm-hmm. Why can't we have the government do that for us like these other countries? And sure, it's not like I just walk in to a fucking clinic in Toronto and everything's magically fixed. But from my understanding, there's a number of countries where if you're there, even if you're just vacationing, they can't be like, you're not a citizen. Fuck you.
Right. They still take care of you. Years ago when I was in Costa Rica, my son got pink eye.
Oh, my God.
We went to a bodega and got the eye meds that I would have had to have made an appointment for, take them in, wait a bunch of time, then go to have a prescription written, go to a pharmacy, and then administer. And it took all of like 5 minutes out of it.
They cut out the middleman, just what Trump aims to do.
Trump
wants you to not have to go see your primary, then go see a specialist, and then get results, and then go back to your primary to talk to yet another specialist.
Right.
I should be able to walk into a skin clinic if I have a condition and get it analyzed by a fucking dermatologist. I should be able to go to an ophthalmology clinic or a fucking TRIA clinic for back and joint pain issues. Yep. Fuck this going to your primary bullshit, because years ago, my primary fucking retired.
Yeah, I don't have a primary doctor. I haven't had one for years.
And when I tried to go to the clinic to get my fucking hernia inspected, they said, well, there's a lady that'll see you. Oh, she'll take me on as a client? No, but she'll see you. So Alina effectively said, we're not going to assign you a new doctor or help you.
Yeah, you can't get a primary.
Figure it out. Yep. How the fuck does that even work?
I don't know.
Health Partners took me, and that's why I have a little Chinese doctor now that likes to feel my tits, and eventually he's going to finger me, and we're not going to make eye contact afterwards. Oh, really? But at least they gave me somebody, and I have had Health Partners or Group Health, its predecessor, all my life when I was a kid, because that's what my dad had. Working for the state, it stayed pretty steady. And guess what? I had primaries. And if they switched clinics or they retired, they found me a new fucking primary. They basically assigned me a new doctor. We can't even get that shit in this day and age. So, yeah, I'm sorry for Brian Thompson's family that your fucking dad's dead and you're not going to have as many sailboat rides with Papa anymore. But the reality here is that Luigi Mangione may have just put into play the first domino that falls towards the people getting angry enough now that we put enough pressure on the system and our politicians that maybe in 10 years we get something done.
I think what you're going to find is that maybe we might have moved the needle a little bit, unfortunately. Not much actually changes. But one last thought. It is kind of ridiculous that we have a government industry that has been losing billions of dollars year after year that we continue to support. And a lot of people don't realize it.
Are you talking about the war on drugs?
No. You can get mail delivered, all subsidized by the government. But
yeah.
you can't get that spot on your neck checked out and seen if it's cancer.
Yeah.
By the government. No. That's got to be for profit.
It's fucking dog shit. And the interesting thing here is that this murder has restarted a conversation. Like you said, it moves the needle. But here's the thing. Long before this kid shot this guy to death, all the same talking points that we made tonight have been on the tips of everybody's tongues for 5 to 10 to 15 to 20 fucking years, depending upon
at least
your age and experience in the healthcare system. And in 2 decades, not a lot has gotten better.
No.
Interact with the show on Twitter at What Do We Call It? That is at What Do We Call It? You can find us on Facebook at facebook.com/group/What Do We Call It Podcast show. For the What Do We Call It podcast, I'm Jmann.
This is Steiny.
And that's the end.